Um, Hi, everybody. Welcome back to A Cup of Joe. I'm sorry, Bill, for that pun. It's a Facebook series of live conversations on topics that are among the most important to the constituents of the Hampshire-Franklin-Worcester District. We launched the series in February thanks to a great communications and engagement director, Caitlin Billings, on our team. And we're doing it to open up a new way for our team to get timely information to the people we work for. You can check out my YouTube channel to catch up on the first two episodes, one with Senator Cindy Friedman and one with Senator Jason Lewis. So as many know, on March 11th, we marked 5 years since the World Health Organization declared COVID-19 a global pandemic. And during the 2021-2022 legislative session, I had the privilege of chairing the Joint Committee on COVID-19 and Emergency Preparedness and Management, long title, alongside then Representative Bill Driscoll. Senator Driscoll, now Senator Driscoll, is currently serving first-term senator representing the Norfolk, Plymouth, and Bristol district, having served in the House of Representatives since 2017. For more than a decade, before becoming a state legislator, Bill provided leadership in the U.S. disaster response and a humanitarian sector, organizing volunteers and coordinating resources across organizations, emergency I'm sorry, Bill. I'm reading your bio and I'm going to start this again. For more than a decade before becoming a state legislator, Bill provided leadership in the U.S. disaster response and humanitarian aid sector, organizing volunteers and coordinating resources across organizations, emergency management professionals, and all levels of government to help families and communities rebuild following natural disasters. And I found Bill's expertise on this committee nothing short of miraculous. And so it was really fun to get to know you then, Bill. Senator Driscoll's expertise in emergency preparedness and management was vital during the COVID-19 pandemic, and I was really grateful to work with him. Senator Driscoll was just named as chair for the Joint Committee on Public Health for this 2025-2026 session, and I had the privilege of serving that for 4 years, so 2 sessions when I was first in the Senate. So Bill, welcome. I'm really psyched and glad and delighted that you're here with us today to reflect on our work together during the COVID-19 pandemic and what you're doing now that you're chairing this public health committee that is in relationship to that time. So if you could kick us off, my friend, talk about being the chair of the Joint Committee on Emergency Preparedness and Management during COVID-19. And if you could just bring that work up to today and how you're thinking about it now, 5 years after the pandemic, and especially now amid such federal turbulence in the public health world.
Yeah. Well, thank you for having me. It's good to be back with you.
I was standing
I recognize the living room.
I know. For people who don't know, Bill and I did many oversight hearings during our time together. And as I was setting this up, I was like, well, Bill's going to recognize where I am. I'm at my kitchen counter on a stack of books having this conversation. So thanks, Bill.
Yeah. And I'm in my car today from the Bristol Agricultural School, not my normal home setup from 2021 and 22, but
yeah, which is so much cooler than mine. Everybody, Bill has like an emblem and he's got a big chair and I park at my kitchen counter. So different.
Yeah, I got really good advice early on, from several different sources in the pandemic. But one of them was said to me, I think you're going to be home for a long time, so you might as well make your home space, able to withstand sitting there for hours on end. And that ended up becoming very true. Yeah, it's good to be back with you on this topic. Certainly 5 years, 5 years in, and I was thinking about it, getting ready for today in our conversation. And I think the pandemic is officially over. I'll tell you why. So yesterday in session in Massachusetts, the legislature extended remote and hybrid meetings for local boards like representative town meeting or select boards. Something that we had done since 2020, kind of on a 6-month rolling extension basis in various vehicles like supplemental budgets. This extension yesterday is now until 2027, with the effort, the intention being that sometime between today and 2027, we'll come up with a more permanent piece of legislation that enshrines this access. The reason it's the end of the pandemic, at least for me, is because there was a last second amendment yesterday. And I found myself actually presiding over the session. So this is my bookend, and good to have this conversation with you. The amendment took out the phrases public health emergency and COVID-19 from the extension order, so that, essentially, where this is a thing that this ability to meet remotely in hybrid setting was obviously done out of necessity in 2020 to start, because we couldn't gather together in large groups and wanted to keep certain people that were vulnerable safe from, but still able to participate in government, whether they were an elected person at town meeting or wanted to testify or do some public speaking. It was all done under the guise of a state of emergency and public health emergency. And so now we're saying that this is one of those things, that ability to meet remotely, that we would like, as a society, as a Commonwealth, to keep in place. One of the things that we learned these last 5 years that really has increased access to government and participation, and letting people, come in and watch and listen and speak when they feel it's necessary to do so, and do that without having to travel, maybe far from home. If you're coming to the State House and living out in Senator Comerford's district, it's more of a hike than mine. Although being down here, and my district extends all the way to Bridgewater, so that it can be a hike versus Milton, where I live. But anyway, the bookend and today's conversation was kind of an interesting signal in the universe as we talk about this. I think to your question around the last 5 years and kind of where we were, when we were appointed to that committee, it was mainly an oversight committee in 2021. It was nearly a year into the pandemic, essentially. I think we were seated in February of 2021. For most people, I think the pandemic would have started, they would tell you, around this time in March of 2020. So about a year in. And we were on the heels of the quote unquote vaccine rollout being lumpy and bumpy, as Governor Baker put it, not going well. I still to this day have never received more text messages the day that the vaccine appointment site broke, which I think was the day after we were appointed to the committee. If it wasn't, it was within 2 days. And so basically we, I think talked once and then woke up the next morning and the vaccine site had broken. We're all receiving text messages from people we know and constituents and family members trying to make appointments for, at that point, I think it was the above 65 crowd. And within 3 days, basically, I think you and I got the nod from leadership. Yeah, we want you to hold oversight hearings, within the next 10 days. So we went from not existing as a committee to instantly having to lead oversight. And so I know we've talked about this in the past, but thank you for all your help and your staff, your team effort to pull that together, because I really do think it was important at that time that people at home, again, most people were still at home or in hybrid working environments, and we're wondering how we were going to get out of that and back to more sense of normal in the world. And being the first committee to hold oversight hearings in general in that session, essentially, other than Ways and Means doing the normal budget stuff, all eyes were on what the governor and the administration had to say and answering the questions that we brought forward. So it's a very interesting time. Not necessarily a time I think any of us want to go back to, but we certainly were involved in some important work during those early months.
Yeah, thank you. I loved working with you in that, and I agree. We have a lot to thank our teams about because they were pretty crushing times. Um, and so a couple of things resonate here. One is the power of oversight. It's one of the things that I don't know that constituents understand, that that's part of our job. Part of our job is to focus attention and ask good questions and raise important issues so that we can get information, bring it to the light, have conversations, look for solutions. Like that's part of what we're supposed to be doing. We counted it up, and between March 4th, 2020, and when you and I stopped our work together in 2022, we did 14 oversight hearings, mostly with you and some as public health chair in the year before. So I do think that was an important function of the legislature, to churn away and to hold ourselves and the administration accountable for working in the best interest of everyone, for a real embrace of health equity, which was something you and I care a lot about, and to make sure that our emergency management system was working as effectively as possible. And that included, of course, public health folks. So Bill, what do you think are the biggest lessons from the COVID pandemic for you as chair of COVID-19 committee, and now going in to chair what I love as the public health committee?
Yeah, I think tying it into your earlier question and then this one, I think and the importance of oversight and what we were doing, because there was, if you remember back in really even 2020 before the committee started, but then certainly in 21, as we, people could kind of start to see the light at the end of the tunnel with the vaccination efforts and trends starting to, I think, become a little bit more predictable as we understood how the virus was transmitted and, whether or not there was seasonality or just the fact that we were an early mover as Massachusetts, early mover, meaning that one of the earlier states to have it spread through versus the western part of the country, which had a few months later, um, their first wave, so to speak. I think that the importance of oversight was really underscored in some of the press interviews that you and I did. And the reason I bring it up is because there was pressure, from constituents, general public. What are you doing about this as state legislators? And we had to kind of remind people. And again, this is important. It relates to your question around our role. We have an executive administration that runs the day-to-day operations essentially of the state. So that's the governor and all their appointees, their secretariats, and we are in this position of being the deliberative body. The House and the Senate as a legislature, trying to set essentially the 100,000-foot framework policy that then gets implemented. And no more was it apparent than in a state of public health, state of emergency, where public wanted to see things happen really quickly, changes happen really quickly, address some of the problems that were occurring. And one of the ways, the tools that the legislature can go about that and has as a tool is to do oversight hearings and ask the questions that everyone has in their minds and can't necessarily understand why there's a delay. And so we were able to help kind of bring to light what the administration was actually doing, what they were doing well, what they were trying to get to a better place, and then also influence the direction of some of those operations and have them pivot a little bit in certain places. And I think that for me, as we did those interviews, trying to talk to the press and ultimately through them to our constituents, really what the role was. We can't necessarily legislate every piece of an emergency, but we can, dedicate the funding to it. We can pass extensions for remote meetings. We can pass different pieces of legislation that ultimately enable the administration and then down to the local level cities and towns, and how they're going to address things on that day-to-day operational basis. And so we are the backstop, for sending the funding toward the different things we want to see change. But it helped me understand my role as somebody, as you mentioned, that used to work in not necessarily public health emergencies, but certainly what we used to call natural disasters, floods, tornadoes, hurricanes, being in a more operational sense on the ground, managing volunteers to help with things and help local governments and help agencies get back off the ground after a disaster event. Very tactical, very much things you can try and implement right away. And then as a policymaker, as we were in the oversight function, um, having to understand how long it takes and how the role was different. And that's something that personally, is something that I think all of us continue to grapple with in terms of how much we can get into the weeds and influence that versus having to stay at that 100,000-foot policy level. And what comes out of that, now that we've all been through this for 5 years, all of us being not so you and I, but general public as well, I think in good and bad ways, um, we're now all experts. And that's what concerns me, to the second part of your question, going forward in public health realm, for future emergencies, whether it's respiratory viral transmission of a novel virus, or avian flu, which is threatening out there, or measles, which is there's a sizable outbreak in some other states right now. um, my concern is that we're all quote unquote experts now, having lived through this in our own way, in our homes and jobs and schools and so forth. And how much will the public, and if there's a public health emergency, um, heed the advice, the warnings, the guidance that comes out of public health, from the national down to the local level, or from the local level up. And that's going to be the test the next time that there's a real concern in Massachusetts, um, because I think that kind of anecdotal concern is that people just say, "Oh, I lived through a once in 100-year pandemic, and this is how I did it," and go about just doing the same thing. And it may be different, and you don't necessarily know what is different. As we know, in the early days, it took a few months to really understand globally how to treat COVID-19 in a more effective way if people were really slammed with it and hospitalized. It took time, obviously, to develop the vaccine. It took time to lower trends, flatten the curve, all that. And all those things were valuable. But I really concerned with the revisionist history of some of those efforts now, because we have the ability to look back with 2020 hindsight and say, "Oh, that we probably could have done that better, or that was a mistake." And maybe that's true, but you have to work with the information you have at the time. And it's I actually asked this question recently, and I think it's important to have these types of conversations to process all of this. And I asked the question of one of the national um, infectious disease leaders during the last 5 years. What now, looking back, kind of a conversation you and I used to have a lot in 21 around triggers and thresholds. When you do understand some of the data, um, looking back, are you able to pinpoint where you may have been able to say, okay, if we get to this level, that we should, change our posture and change our tactics around, could be mask wearing, or vaccine mandates, or percentage of people in a certain indoor space, things that we implemented and unimplemented, and then wrestled with having to do it again. And I think people really focus on, and this is natural, it's with anything, the origin story. Everyone goes back to 2020 and what we did then. It's like, well, no, but once we understood a little bit more, then what did we do, and what would you do differently in that space? And I think that's where we really need to focus, and I hope that we learn the lessons from, because I think there were some really important things to come out of this. So I can talk forever, but
No, and
um,
I love this.
yeah,
And I think it's important, as you say, to take, for those of us who were there 5 years ago and grappling with this, for us to understand what we did. And so what the legislature did, as you said, and just for folks listening, is we hunkered down. The House and the Senate each figured out their own organizing structure so that we could keep doing business, passed a lot of those provisions. And then over time, really engaged both in the Public Health Committee and then in the committee that you and I shared, Bill, on pretty significant oversight to get the information we needed in order to pass the money and the policies that were necessary, and also to work effectively with the then Baker administration and what they were doing, to get answers for our constituents, to get answers for our own policy and budget needs, and to, as you said, move the needle toward what the legislature thought would be effective. And then all along the way, we had to learn all these lessons, because we didn't have a path before we got into this, but we had to make one. And we had to do that with information and really good collaboration. Um, and then go
yeah,
back and do it all again, right? Because we would get new information and it would make us want to do some different policies, or spend money in a different way. I'm thinking about when we leaned in, both the House and the Senate, on more of an equitable approach to contact tracing and to outreach for vaccines and for testing. We recognize that these huge hubs, which you and I were both concerned about, were not as accessible, because we hadn't been able to invest in the local public health folks, or the local HMCCs, which you and I became devoted to be able to have them have the ability to see their neighbors and to treat and test and contact trace their neighbors. We were wildly uneven in our ability as a state to stand them up. And so we invested initially in these very, very big stadium-like places that left a lot of people out initially. So we had to go back and reappropriate money, and move with the administration toward what I think in the end was a much better footing. But it was pretty painful and pretty painstaking, to have those conversations along the way, informal oversight, and then in informal meetings. For folks who don't know, I think it's okay that we say this now. um, Senator Driscoll and I also coordinated House Senate conversations with members of the Baker administration on a pretty regular basis. So we could get answers directly, and all of our colleagues would come and ask questions, and then we would get the notes out and we'd get more questions and we'd get them answered in writing and we'd get those back. And again, part of what a government has to do is figure out how it shares information, how it makes decisions, how it
yeah.
keeps people informed, how we build trust, how we move as quickly as we can. And Senator Driscoll and I were charged, and I was pretty new, Bill, charged with doing that, and keeping our two chambers working together. In part, that was partly what we were doing. Oh, you're on mute. There you go.
Part of 2020 for me was that yeah, the internal kind of working group, um, and helping figure out how to essentially keep the House and working with the Senate and the legislature, um, functional when most people couldn't be there, and just the mechanics that everyone in their own businesses or schools had to go through the legislature in the same way with its own uh, nuances and idiosyncrasies how to figure out how do we have 200 people vote on pretty serious things, and how do we have debate, how do we stay in contact um, with one another. And the legislature went through the same type of upgrades and conversations that everybody did at home. The computers that we had at the time didn't have microphones and webcams, so it wasn't even like we could have gone and raided our desktops from our offices and brought them home. And so we had to go through that that type of similar experiences that a lot of people did with their jobs. But at the end of it, yeah, we're in a place where could work with our colleagues, work with the administration to get answers to questions that were coming from their cities and towns, and then be able also to flow information back through the legislative offices that the administration was trying to get out to people. So it is a it is a as they say, a very full time effort. Thinking about my people that I worked with at the time and staff, and I think it was like a year, more than a year in. For unemployment, a lot of times we do constituent services as legislators, liaising with state agencies to get answers. So what someone might be facing some kind of barrier or kind of the quote unquote nameless, faceless organizations and trying to find answers to something. It was like a year and a half in when someone finally said, "I think our last constituent case is closed. Like this is the first time in a year and a half, 2 years that we haven't had dozens of open cases." Again, because so many people were out of work or had their work situation changed dramatically. But it was, and we're doing a lot of that from home most of the time, and it just added its own flavor to everything. I do think your question around, um, in your observation around like getting information out to people and how things were working. One of the other bright spots that I think that we have learned an effective lesson on from this experience is the importance of also not only having like the contact tracing, which is I would say like pretty invasive from a sense of you have to get a test, in this case in COVID, you had to get a test, like a PCR test done, lab results, and then contact tracing where you're reaching out to people that you may have been in contact with. You're also getting, outreach to ask invasive questions. And I think what we learned is people are willing to do that for a period of time. It's also really good to have passive surveillance. And so this was when wastewater surveillance became front and center in a lot of ways. And this kind of like new technology, so to speak, um, came to us. And I think that that's something that going forward, to continue to develop that so that whether you can look at an entire population like a city or town or a region, like the MWRA, 40 cities and towns sewer systems, or go and pinpoint right to a specific building like on a college campus or some kind of regional facility and passively track um, COVID or flu or opiate use and you name it. I think as that can be developed and implemented in the future, it'll help us identify trends. Originally, if you remember back, it was developed in Massachusetts. There was a pilot program which ultimately allowed for a pivot point into tracking COVID passively,
Mhm.
um, to track opiate use in wastewater, and that's again very relevant to public health and understanding what is or isn't working in certain regards, to address big issues, but also gives us the ability to monitor trends in a way that okay, then we're going to have to change our posture, um, whatever the issue is, and and maybe do some things differently and without invasively asking people to answer questions or take individual tests. And so that to me was a really big leap forward that I don't think we can overstate. But I'm also concerned that it's the preparedness paradox. It's the things that never occur, you don't see occurring, that then kind of get tossed to the wayside. And so, can we, continue to invest in that type of surveillance and innovate in that space that will help us address future issues or things that we may be able to apply it to today that will help us address issues. So that's another bright spot, but I again concerned about kind of that preparedness paradox. The further
Yeah.
away we get from it.
Right. And we forget quickly how much we needed that in that moment. And just for sort of to just tie it back into the oversight, part of what Senator Driscoll and I heard about and then would churn into hopefully investment by the legislature or better collaboration with the administration during all of these meetings, were things like PPE or the rapid test innovations or wastewater. So we heard about that. The legislature invested in this, and all of a sudden we had unbelievable data access, which then helped with contact tracing, helped with testing, helped with getting vaccines to specific areas because we could see it. And in wastewater, you can see it about a month before it becomes a thing because you see it building, and people who are smarter than me about this understand how to read wastewater. And so it's one of the things, it's one of the lessons that is still, as Senator Driscoll is saying, still very present with us today, and we continue to innovate on. I'll just say the other thing that we learned painful lessons about that we talked about earlier was the unevenness in local and regional public health's ability to respond. And in the years since COVID, the legislature has passed a pretty sweeping public health bill. And we are not ever, I hope, going back to a time where your zip code determined your public health protections. That's what we had in March of 2020. It's one of the reasons we had to invest huge sums of money in these constructed entities because we couldn't rely on a community-based entity, and that was harmful ultimately to the people we served, and people on the margins, people long overlooked, poor people, immigrant communities, people of color, rural communities. You know, we got sick more, we got sicker more, we went to the hospital more, we died disproportionately, and that was because we didn't have an equitable infrastructure in the Commonwealth. And like wastewater testing that we still, both the senator and I care a lot about, and the legislature cares a lot about, and the administration cares a lot about, you know, public health remains one of the lasting pieces of work that we're not letting go of, so that we have an answer for people to say, what did you learn? You know, after, what did you learn from COVID? What are you doing differently today? You know, we're doing both of those things differently. We're doing, as Senator Driscoll said, well, a lot of democratic gathering better and more sophisticatedly. But, you know, there are many, we don't have time because we're about to end, Bill, but we don't have time to talk about all the lessons, but there are countless lessons that change the way we think about the issues like public health or emergency preparedness, or the way government should function. And then much more than that, that are in play now because of what we learned 5, 4, 3, 2, 1 year ago. And it all has to do with this COVID pandemic. So Senator Driscoll, I'm really so grateful that you just spent 30 minutes going back in the Wayback Machine. And I'm even more grateful for your work. And I'm really glad, especially now, Bill, that you're leading for the Senate, the Joint Committee on Public Health. I do think the kind of vigilance and super nerdy, deep work that you like to do is going to be important because you named some things that are on the horizon for us in the Commonwealth. And I'm glad you're at the helm. And thanks for talking to the constituents I work for out here. And I look forward to partnering with you in the months to come.
Yeah, thanks so much for having me, and thanks for being there throughout all those hearings. But certainly today, I am emboldened or comforted, and you know, having you been in this role in the past as public health chair, and now me having to fill it, certainly won't be the last time we talk. I'll be leaning on your experience.
Well, there's lots of us in the Senate, as you know, who care a lot about this, but we all have your back, and we're also grateful you're there. So this is all the time we have. Senator Driscoll's taken this from his car, and we're grateful that he did. And for folks who are wondering what comes next, you tell me. You tell me who you want to talk to, and I'll go find them and ask them, and we'll bring them to you like we did with Senator Driscoll and public health and emergency preparedness and management and the COVID pandemic. So take good care, friends, and grateful for you. Thanks, Senator Driscoll.
Thanks.